So now I'm going to put on an adult pediatric circuit, and this is the adult pediatric circuit. Comes in with the label here, and this is what comes in the adult pediatric circuit. We've got our our expiratory valve here, and the flow sensor tubing on the ventilator end, and then on the patient end I have my flow sensor with my little connector which comes with every circuit. That's going to allow me to calibrate the flow sensor. So again, I always take off my expiratory valve when I'm putting it on the ventilator, because it's much easier to put on while it's not on the circuit. You take off your disposable cover, pushes in, you twist it anti-clockwise to make sure it's in fully, then it gets a 1/10 turn clockwise to lock it in. Then my circuit pushes on the fixed elbow, like so. And then my flow sensor tubing is color coded, blue and no color. It's stuck together when you take it out of the packet, so you need to peel it apart a little bit. And then it sticks on blue to blue, no color to no color. And that's my circuit now is ready to test. So, the first test I'm going to do here, underneath the shortcuts, is my the pre-op check. So the first test I'm going to do is my leak test. So you hit leak test, tells me to disconnect the patient, and then when you're prompted to block the breathing circuit, if you just occlude the circuit with your hand, and then it says test in progress, and it's just looking for a leak anywhere along the circuit, and then hopefully we'll get a green tick and the date and the time. Okay, so the next test I'm going to do is my flow sensor, and here's where I'm going to use this little adapter. What the adapter is going to allow me to do is to push it in, take off the flow sensor, turn it backwards and plug it in backwards. It's the only time you use it during the calibration. Each circuit comes with your adapter mounted here on the circuit. So we hit flow sensor, it tells me to disconnect the patient, obviously we have, and then it prompts me to flip the flow sensor. So we plug in our adapter, unplug the flow sensor and plug it in backwards. You only get 10 seconds, it's a time limited prompt, so if you don't do that within 10 seconds, the test will fail and make you start again. Okay, so you see now it says calibration in progress, and halfway through it's going to ask me to flip the flow sensor back, and we're going to unplug it and turn it in backwards. So just waiting for that prompt. Here's our prompt coming up now. Flip the flow sensor. So you only get 10 seconds from the prompt. So unplug your flow sensor, plug it back in the normal way, and then again it says calibration in progress. I'm just going to mount that back on here, or you can dispose of that now if you want, that we've used it. And then we get our green tick, date and time. And then the third one, if you have a green tick beside the O2 sensor, you don't need to calibrate it. If there's a red X here, you must do it, or you can do it if you want to do it. But to do it, all you do is you press the button, and then we wait 2 minutes until this bar comes across to 100%. But that's all you do. Press the button and wait 2 minutes. Okay. And then the last thing that we will do is put on our HME filter onto the patient end, and now the circuit is ready to attach to your patient.